Thanks, Mary, and thanks, Don, for that nice teeing up of a number of the issues I'll be talking about. I first want to say thank you for inviting me. It really is an honor to be here, and I'm really have to congratulate the work of the IOM Standing Committee, and certainly, Sharika, your leadership. And as somebody who lives and works in D.C., I'm going to miss seeing you around every few months, but I know, actually knowing many of you, you're going to be back on a regular basis to do the work that you do and hopefully educate a lot of the lawmakers and policymakers we have who, as you'll see, need a lot of education and encouragement to continue and at least do the right thing. So it doesn't take much, and I think we've heard it from a number of the speakers already this morning, and Mary highlighted some findings as well, and Don knows this all too well from his work in Philadelphia, but it doesn't take a lot of looking around the headlines to see that clearly vulnerable populations, and specifically the target of this conversation, they really are targeted, and there really are much fewer opportunities for them to really make the healthy choice the easy choice. It is far more difficult for those in low-income neighborhoods, African Americans, Latinos, Hispanics, to do what it is they think they know they should be doing, and it's much more difficult. As Mary said, they really oftentimes have access to foods of poor nutritional quality at a much greater degree than others. Fast food marketing is really targeting minorities to a much greater degree than others. Minority children drink more sugar fruit juice and sugar-sweetened beverages, and fast food restaurants are near schools more often than they, in low-income and black neighborhoods, more often than other neighborhoods. So again, this is just a very small sort of collection of some of the headlines, but we know that there's clearly a lot of work to do in addressing health disparities. I'm going to dig a little bit into schools just because I do think schools have been in the limelight lately. I mean, for a good reason. Kids spend more than sometimes 50% of their time in schools, and oftentimes consume up to 50% of their calories in schools. So I do think it's certainly one of many areas to target, but a really good one in terms of getting to children. And we do know from Bridging the Gap research that students in low socioeconomic areas who attend schools in those areas also generally have access to weaker wellness policies. A lot of this research is from Bridging the Gap. They attend schools with less nutrition education. Obviously, that's a little different in Philadelphia with the great work that they're doing with the SNAP Ed dollars. They have fewer opportunities to access fruits and vegetables, salads, whole grains. They have access to less healthy snacks and snack foods through competitive foods like a la carte items in the cafeteria, vending machines, school stores, et cetera. And to the point of the first panel, they also participate in sports programs less frequently, oftentimes because the programs are not available to them, and they also attend schools that really don't share their rec facilities, and as we heard this morning, have inadequate rec facilities oftentimes as well. But this isn't to say, like, the Savior has come and we are all here to celebrate that schools are automatically going to become healthy places. But I will say we did have a pretty significant breakthrough in 2010 when Congress passed and the President signed the Healthy Hunger-Free Kids Act. I like to say that this was way back in the day, just about 2 years ago, when Congress actually was productive and happened to pass laws that were very health promoting. And I do think that it was a real step in the right direction. There was certainly some controversy with how some of the provisions were funded, but we are where we are right now with the Healthy Hunger-Free Kids Act, and it really was a significant step forward in terms of improving the quality or taking steps to improve the quality of the foods and beverages offered in all 100,000 schools across the country. And a couple of the provisions in the Healthy Hunger-Free Kids Act, it really did pave the way for improving the quality of school meals in schools as well as in child care settings, and it had some provisions in there to help improve access, so kids who were eligible would actually participate in the school meal program, school breakfast, school lunch. It established nutrition standards for all foods, and this was a pretty significant victory in the Healthy Hunger-Free Kids Act, because this was the provision that basically will require eventually all the foods and beverages in schools to meet nutrition standards. vending machines, school stores, et cetera. Right now, schools really just have to take a look at what's in their cafeteria. The vending machines in the school stores are not under the purview of the school food service operation or the school in general. A lot of schools and districts have made strides in that area, but it's not universal, it's not widespread, and it certainly oftentimes is not targeting the very low-income and ethnic minorities that we want it to. It also had some language in there to strengthen the local wellness policies, again, really empowering local officials, parents, other advocates to take action in their school environment. Expanded the after-school meal program, which is a program that really does target vulnerable children in particular, and reduces administrative burdens. So what does this look like in terms of school meals? We've actually seen the school meal standards already improved and in place. Schools needed to start serving healthier meals as of this school year, 2012 and 2013. So we've seen these changes across the country, and we hope that the top meal is not the pervasive meal anymore of a corn dog, French fries. Basically, I call that the monochromatic tray. It's really all generally one variation of a color besides that red, I won't even call it a vegetable up there in the corner, the ketchup in the corner. But hopefully we're seeing more healthier items that kids also still really like, but are much lower in fat and sodium and sugar and a much more reasonable portion size and calorie amounts. And I know you're going to have a good presentation by Rodney tomorrow. He's the rock star of school food services, and I know that Arno will also be talking about some of their work in California. So suffice it to say, we have seen some pretty significant improvements in the school food environment. Still struggles, still implementation issues, still threats by policymakers to rescind the regulations. I'll talk a little bit about that as well. But we're certainly on the path, on a good path on the school meal front. We just need to kind of keep moving forward there. Snack foods, those are called competitive foods or snack foods and beverages in vending machines and school stores. The Healthy Hunger Free Kids Act did give USDA greater authority to basically regulate snack foods. So instead of just looking at what's in the cafeteria during the meal service, USDA now has greater authority to look at all the foods and beverages across the school campus from the beginning of the school day till the end of the school day. And USDA did issue proposed regulations, which is the first step in the process of moving forward to improving the quality of snack foods. And their proposed rules were pretty good. There are a couple areas we hope they tighten in the final regulation, but generally, if we do see this to fruition, so to speak, we're going to see more fruits and vegetables and whole grains and low-fat dairy, reasonable levels for calories, fat, sodium, and sugar, limited sugar-sweetened beverages, or very, very strict limits on sugar-sweetened beverages, hopefully, again, in the final regulation. Reasonable portions for beverages as well. And to Mary's point, there really is language in there. The Healthy Hunger Free Kids Act did include a provision that required schools to offer for free and have readily available water at lunch. You would think that would already be a duh, isn't that already the case? But oftentimes we see it's not easily accessible. There might be one small water fountain in the corner that nobody really wants to go to because it's kind of gross anyway. So we do see that there seems to be more of an emphasis to make sure that that free water is easily accessible during the meal service. We're waiting for USDA to finalize the regulations, and they're in a little bit of a tight timeline. We hope to issue regulations before that magic date of July 1st, because if they issue them by July 1st, then they need to be implemented by 2014. If they issue them on July 2nd, they don't need to be implemented until school year 2015, and that's a long way down the road. So we'll see. It's a tight timeline. We know they're working hard, and we hope that they can come out. We're not, I don't even want to bet on that one, but needless to say, we'll still be working hard with schools to continue to implement the changes, do what Philadelphia has done, do what a number of districts across the country have done, and do it on their own until the regulations come out. But what would that look like? Hopefully, a lot of the snack foods currently in schools, like candy bars and high sugar drinks, et cetera, will be replaced with healthier options, such as fruits and veggies and yogurts and that kind of thing. Some of the other federal programs, and I talk about federal programs when I was thinking about preparing for this panel, I really want to sort of highlight, I think, what many of you know, and that these federal programs, many of them already target, their target population are those most in need of these programs. So they're vulnerable, vulnerable families, low income, Black, other ethnic minorities. So I do want to kind of make sure that that's fully 100% understood, because the reason why we really need these programs protected is because their very audience and target population are those that we care most about and really, really need these programs significantly. So threats to funding levels, et cetera, are really going to significantly impact these populations. So WIC Food Packages, IOM, has done some great work on the nutrition assistance programs in general. WIC Food Packages, Child and Adult Care Food Program, the school meal standards, the competitive foods standards, all of those, the recommendations, and in some respects what's finally in place, have been a result of the recommendations from the Institute of Medicine. And the WIC Food Packages were finally, for the first time in many years, updated a few years ago. And we've seen some really nice success and some nice outcomes. We've seen retail outlets that accept WIC vouchers are providing healthier products across their whole portfolio. We see retail outlets that don't accept WIC vouchers, but that are in neighborhoods that do accept WIC vouchers, also improve the quality of their offerings, because there's a competition out there among retailers. So we do see that these programs and changes at a macro level can have a really significant impact at the community level as well. We're waiting for USDA to issue updates to the meal patterns that are in child care facilities, and we're not sure when that's going to come out. There's obviously a funding issue when you improve the quality and offer more whole grains and fruits and vegetables. That can be more expensive, so there's a real balancing act of how best to do that within the limited reimbursement rate. And Don talked about the Farm Bill, and I mentioned this because the Farm Bill is a huge piece of legislation. 76% of the Farm Bill goes towards SNAP, the Supplemental Nutrition Assistance Program. So ironically, it's called the Farm Bill, and again, the majority of funding is for the SNAP program, and 46 million people participate in the SNAP program, and again, these are the most vulnerable low-income populations. What's interesting is over 90% of those that participate in SNAP are either children, the elderly, or disabled. And I think they're obviously, whenever you hear the debate in Congress, you'd think it's people who are ordering lobster and filet mignon every day, and there's so much fraud in the program. And it has one of the best, lowest fraud rates of all the federal programs across the board, less than 1% fraud in the SNAP program, yet it's still consistently under attack. In the Senate alone, they're debating probably as we speak what's going to happen with their version of the Farm Bill. $4 billion in cuts already proposed, which would not just limit those who can receive the benefit, but it'll also knock about 200,000 kids off of the school lunch program. The House is even more drastic with $20 billion in cuts. SNAP Ed, the education component that helps SNAP participants use their benefit more wisely, is also under threat. As Don mentioned, there are some good things. Again, there are payoffs, but there are some nice incentive-based approaches that build on some of the work in Philadelphia, in Detroit, and other places that really help SNAP participants utilize their benefit in other ways. And I was just thinking also about some of the strategies, some of the other strategies as part of the recommendations that Mary outlined. And we've seen other policies really focus on limiting sugar-sweetened beverages and promoting healthier beverages. And I'm just going to I'm actually not even going to touch on this too much because Don did a nice job on the taxing issue in Philadelphia. Healthy Eating Research issued some recommendations on healthier beverage guidelines that we've seen included in and hopefully we'll continue to see included in schools and child care, public government property recommendations and policies that are coming out, and hospitals. Menu labeling, we're awaiting anxiously FDA's final ruling on menu labeling. I think this is a really good case study of having the local and the state policies really drive the federal policy efforts. It was really once the National Restaurant Association realized that they didn't want to deal with a patchwork of policies out there. They came to the table to really support universal menu labeling. We also hope that we can make some dent in improving the quality of the children's meals that are offered in menus, and RAND has done some nice work in coming up with some recommendations in that space. The last slide I just want to close with, or almost the last slide, everybody says that's the last slide, and it's like, well, there are 3 more slides after that. Yeah, but one of them just has my name on it, so that doesn't really count, so, but almost my last slide. Healthy public places, I think Mary mentioned this, and we've seen a lot of really innovative things happening across the country, certainly at the federal level, but obviously at the local level as well. And just yesterday, the National Park Service, part of the Department of the Interior, announced that from now on, the parks are going to be offering, as the contracts expire and they renew contracts, they're really going to make a significant effort and making sure that they're procuring and selling healthier snacks and beverages. So when you go on your 10 or 5 or 3 mile hike, you aren't then confronted with huge bottles of sports drinks and junk food. You can actually have healthier options available. So that's kind of cool. It's going to percolate obviously through all the parks. I'd like to also see that complemented with the work we heard this morning from Robert and Mara in terms of really making sure that we're getting parks in places that really need those parks the most. Department of Defense has a Healthy Base initiative that is taking a look at procurement policies across the board for their training facilities. We know that military recruits, the #1 reason, medical reason for not being able to join the service is obesity. As a retired Navy commander, I think that if I did not have that opportunity to be able to serve, I think that would really be not a good situation, and I really benefited from my service there, and I'd hate that men and women who want to join cannot because of that reason. Chicago Park District has done a lot of work in this space. The city of San Antonio has limited sugar beverages in their county government offices. New York City Department of Health, we know a lot of the work that's coming out of there, and there's a real emphasis on procurement policies as well. Public Health in Seattle, King County has done a lot of work. So I think this is, to me, also what's going to be one of the sort of next phases of the healthy food environment, is to really identify what are those triggers that will really influence a much wider sort of scale in terms of setting policy here and having it impact at the local level. But I also will say that a lot of the policies that we have at the national level, in fact, I'd say every policy that we have at the national level started from somewhere, and oftentimes it started in a lot of the community advocacy things that we've heard about today, whether it's Philadelphia or the advocacy work in California on really improving the parks, or Baltimore and Washington, D.C. There's not a single federal policy that you can say, yep, that's what the lawmakers came up with, thank goodness, because there really wouldn't be many good ones on the books if we just left it up to those in Congress. So we really need those local stories to permeate up, and everything that we have in the Farm Bill and Healthy Hunger-Free Kids and menu labeling was really because of those local efforts. And I think what will be important, especially for this discussion, is to ensure that we are viewing these policies through the equity lens. I think when we see that happen, as it clearly is happening in Philadelphia and some other places, we really see the closing of the gap, and not just everybody decreasing obesity rates, but really decreasing them significantly in certain populations. So that's a challenge. I think that that's something that we all as advocates need to always be thinking about when we're working on policy issues. So with that, I'll end it there. Thank you.
Thank you, Tracy and Don. And we're going to have a slight change in the program. We were going to have, as we did in the last panel, an intra-panel discussion. But in order to keep on schedule, we're just going to move right into the town hall panels. So we would have the panelists from both panels come up, as well as the moderator. And I'd like to just briefly introduce the moderator for this next session, Bill Purcell. He's a member of the IOM Standing Committee. He's an attorney in Nashville, Tennessee, and he served 5 terms in the Tennessee House of Representatives. And then he founded and was director of the Child and Family Policy Center at the Vanderbilt Institute of Public Policy. And he was also vice chair of the IOM APOP committee. So I'll turn it over to you, Bill.